U.S. Senate's Finance Committee passed their version of the health care reform bill.
Now, with so many different reform plans out there, it can certainly be hard to understand them all. But imagine just how hard it would be to navigate the whole health care debate if you didn't speak English. Well, Jamie Hirsch talked to some people today who are trying to learn English and about health care in this country. Good luck.
Exactly. Both of those very difficult tasks, if you ask me. Now, the women I talked to today said that there's a lot to learn about the U.S. and the culture here in Madison. And as they're finding out, the American healthcare system has a language of its own. When Candy Kruger feels sick, she has a number of questions for the doctor.
If I do have a fever, what should I do? And do we have to come back again? Do I have to make an appointment again?
Problem is, she can't always find the words to say to make her doctor understand her. For people like Candy who speak limited English, talking to the doctor can be tough.
It's kind of nervous, confusing. I'm not sure what she said, and I asked her like 2 times already. I don't want to ask her again.
A lot of what happens is that people in their communication with a doctor or a nurse feel intimidated. And so they're afraid to ask too many questions of a doctor or a nurse.
The Literacy Network in Madison provides free English classes. These days, one of its main goals is to help people understand health care.
The tutors will give me all the information I need. Sometimes she will write all the questions, what I need to talk to the doctor, what should I ask to the doctor.
Jeff Burkhart says poor health literacy costs Dane County alone more than $430 million a year.
A lot of families will use the emergency room for basic health care because they don't have health insurance. And so we're trying to make sure that they know that there's a better way.
And health care can be confusing to everyone, not just people who speak another language. That's why Burkhart's message to all people is simple. Ask questions.
From the point that you walk in the front door to the point that you're dealing with a nurse or a doctor, ask the questions that you feel need to be answered so that you can advocate for yourself.
Burkhart says literacy skills are one of the biggest predictors of a person's health care status, more than race, age, or income. He also says it's no wonder many people end up needing to find out more information if they can't even read prescription labels or ask the questions that they really need to be asking.
Yeah, you do need to take the time to ask. Jamie, thank you. The Literacy Network is hosting an event this Saturday to talk more about health literacy. And for more information about that, check out our website, WKOW TV.com, and click on this story.
A team of business owners and school administrators want
a report for you here in just a bit. As we all try to understand the different healthcare reform plans, you can imagine how hard it would be to figure out if you didn't know English. Well, the Literacy Network in Madison teaches English to people who speak other languages. And officials there tell us one of their biggest goals is to teach their students about health literacy.
It's kind of nervous, confusing. I'm not sure what she said, and I asked her like 2 times already. I don't want to ask her again.
A lot of families will use the emergency room for basic health care because they don't have health insurance. And so we're trying to make sure that they know that there's a better way.
Attraction? Jeff Burkhart there with the Literacy Network says health literacy problems cost the Dane County healthcare system more than $400 million every year. Burkhart says it's no wonder people end up needing emergency care if they don't know how to read the drug labels, for instance, or how to ask their doctor the right questions about their health.